issue and why I feel that nurses should get involved and advocate for the health of all, which I heard that mentioned before. I noticed a lot of similar things being said tonight. So Assembly Bill A7625 relates to the reporting on the presence of water contaminants in groundwater and surface waters. And this is a bill that will help increase the testing of New York State water. What we all know is that the environment and the health of the environment affects everyone's health. Most people, including myself, know very little or nothing about the policies that protect our health. We all work in healthcare, we're nurses, and shouldn't we all have a little bit of knowledge about what policies are in place that directly affect all of our health? So the Emerging Contaminant Monitoring Act was passed 2 years ago. This act requires that water contaminants are tested for and documented and published to the public in New York State. New York State, as of yet, has not created this list for us, the New York State residents. And the bottom line is that this Assembly Bill A7625 will enforce that New York starts testing more of our water supplies. So why is it important to support clean water? Well, the top line right there, we all know this. Water is necessary to sustain life. And I think everybody agrees here that we should all have access to clean and safe water. Here's this big word safe tonight. So who is in support of this? The United Nations. This is one of the basic human rights. All the countries that are a part of the UN support this. So shouldn't nurses also support safe drinking water? So everyone can understand where our drinking supply is coming from, this is a picture of what groundwater and surface water is. So the groundwater you can see is underneath the trees, and this is where water accumulates. And in certain areas, it accumulates in larger amounts, and that's known as an aquifer. Where it has accumulated and is able to be extracted from the ground, and it's supplying 50% or greater of a population's water, it's called a sole source aquifer. And New York State has 9 of these sole source aquifers. And the issue is that these groundwater and surface water can very easily become contaminated. And again, this is something that we are all aware of. We're aware of these contaminants. I'm sure most of you can list a bunch of them. There's the agricultural, fertilizers, there's medical waste, and the big one, industrial waste. Even airplanes and automobiles are polluting these sources of our drinking water, the groundwater and surface waters. So here's a list of New York State's top water contaminants and the contaminants that are above the EPA's reference concentrations. And the big one that I'm going to just quickly go over is the second line, the hexavalent chromium, the chromium 6. This one became famous all over the country because of the Aaron Brockovich story. So we all know that this causes cancer. We absolutely know that this is causing cancer. And the scary thing in all of this is that this chromium 6 is in 2/3 of all of the water supplies in all of America. And this is directly from industrial waste. This is something that we are allowing to occur. The policies that are in place right now are allowing these things to be dumped into our water sources. So another hot topic, one of the emerging contaminants is this PFOAs, and as the picture is showing right here, one of the big source of this is the firefighting foam. But it's not just the firefighting foam, it's everywhere. It's in our clothing, it's in food containers, and as you can see here, the other furniture, fabric, and it's considered a forever chemical. It's fully synthetic, and it never goes away. And the little joke about this is that some very lonely scientist created this because he wanted a forever friend with him. And this is just, you know, this is, in my opinion, I hope not just my opinion, is a big concern for all of us. I'll skip over just the specific to the capital region. And here we go again. I mean, who wants to drink the cup of water on the right here? I mean, this is clean water. And I'm somebody who has just assumed my whole life that my drinking water is safe. I never thought that the government wasn't testing it for me, but they're not. And everybody knows, I mean, hopefully everybody understands that contaminated water creates and spreads disease. And there are so many things that goes on with this, and it's something that I really feel that nurses as advocates for health should be backing this up. So here's another beautiful picture of some water. It's very colorful. It's you know, there's a rainbow of colors in there, and that's gorgeous. But this water is so unsafe that it's not even safe to touch. And the reason why this assembly bill is so important is because the policies that are in place right now, the public water is only tested if it's a population greater than 10,000. This is a big issue because this leaves 6.4 million New Yorkers without water that is being tested. And a big source of this is people who have well water. Well water, it's not mandatory. You know, the government, the New York State is not testing this water. They don't have to do anything about it. So this is another 4 million people. In New York State, there are 11 counties where the water is not being tested because they don't have populations greater. And safe water, I mean, as we go back to what the UN said, this is a basic human right. So why are people not supporting being aware of what is going on? So here, this picture always grabs me, sorry. So another reason, here's an example, a famous example in New York State, Hoosick Falls, a community that falls into this category of less than 10,000 people. So their water was not being tested. And they just, unfortunately, were also in a town where there was a big chemical company that was creating these PFOAs and dumping them into the water because the only thing you have to do, you know, very quickly saying that, is as long as these chemical companies get permits to dump the water into these water supplies, they're legally allowed to do so. So the one resident took it upon himself to have the water tested because he was noticing how a lot of people in his community were getting sick and getting cancer, and he wanted to know why. So he sent this water out to get tested, and here we go. The PFOA levels were found to be 580 parts per trillion, where the EPA's limit is only 70. Well, this was very concerning for the public, the people of this community. I mean, this was very eye-opening. So they had their blood tested. You know, where do people go to get their blood tested? You know, these are healthcare facilities. You know, this is an issue for healthcare. Including these children right here, their blood was found to have 15 times the national average of PFOAs in it, and this is very alarming. As we can see, there's many diseases that are known that you're at increased risk of. Look at this top one, ulcerative colitis. And in healthcare, is there anybody here that knows somebody with ulcerative colitis or has taken care of a patient? This is a terrible disease that you wouldn't want to wish on even your worst enemy. It affects their daily lives, and anybody, again, you know, nurses know the impact this has on somebody's lives and the pain that these people suffer when they're having a flare-up. So I really do feel that nurses can change the world. We spend our entire lives as advocates for our patients, and I really think it's time for nurses to stand up and, you know, advocate for the health of all. Nurses are leaders, and they really need to start seeing themselves as leaders. Every day we are leading our patients and even the doctors through this maze of healthcare. And also the experts. We are the experts at assessing we're constantly doing it. I see people here as they're talking to me, they're assessing the situation. We automatically recognize what is wrong, and we automatically act on correcting that. So why are we not acting on correcting what's causing, disease in our communities? And it is well known that when people come together, and just as was being said before, when people unify and come together as a group, it makes a much larger impact on the legislators and the people creating these policies. And again, we are here in this large group of people, and it's because of the ANA. The ANA has brought us together, and we are all a part of the ANA. It's not them versus us. Even myself, just as being a member, I joined the ANA because I want to be a part of this group because they do so much for nursing. I mean, here's a very small list of what they're doing, but it's just, again, it's that trust. I mean, we're trusting what we're doing when we walk into that room with the patient, because the ANA has verified our standards of practice, or because they're using evidence-based research. I trust that. I just automatically trust that what I'm doing and how I'm caring for these patients is going to help the patient, that it's going to create help for them. So that's what I want. I want to create help. I want to eliminate these things in the world that we know are eliminating the health of our families, of ourselves. And so just please get involved. I just really think it's in the best interest for all of us, because I know I don't want to increase my workload. There's already unstaffed staffing. I don't want to add to that. And I just really want to tell everyone, this really is a beautiful area. If you're not from upstate New York, it's absolutely gorgeous this time of year. And you just happen to be, by coincidence, in the location where some of the cleanest water of all New York State is. And I just really hope everybody, please help to keep it. Thank you. And yes, and just again, going to the legislators is very important. I stopped by my local legislator, and it's not in this copy, but he was very open to listening to what I had to say, and it does make a difference. Thank you.
Okay, thank you. Back in the morning, breakfast